Hi, good evening, Slam and fellow classmates. I'm Stephanie Chen, and my topic tonight is anti-doping on athletes. First of all, let me introduce the case. Jolene Chaponio, she's a Kenya trail running athlete. She's a mother of two, and she's the winner of this year UTMB OCC and the Surisino, which is just like 2 months ago. But then she was being tested positive that she got a banned substance in her body. And she got 2 years banned from all trail running competition, and her prize money and medals was need to give him back. Let me give you some backgrounds about this case. For Kenya, I think most of you will know that they are really good at long distance running, and they got lots of champions. For trail running, actually it's a long distance running, but running along the mountain. And for Kenya, actually it's a quite new sport. I think you may know that Kenya athletes, they are not really very rich. Some of them want to win the prize money to get out of poverty. For Jolene, I think is also the case because she got 2 children to feed. Other thing that I need to introduce is the WADA, which is the World Anti-Doping Agency, which is responsible for testing athletes who may be in competition or out competition may have doping, and also they are responsible to educate athletes for which substance is banned or not. For Jolene case, the substance she take actually is good. That means she can having it out of competition, but it's banned in competition. If she want to use it in competition, she can apply TUE, therapeutic use exemption. But she didn't. For Jolene's side of story, she have said that actually she have limited access to medical treatment in Kenya, so she turned to a local pharmacy, and the doctor recommend her for this painkiller, and also assure that it is not doping, and it will make her recover in time. And I think Jolene actually really desperate for medicine because the turnover is quite quick and make her knee so painful, which she can't run as fast as possible to win the game. And also she needs the prize money to feed her children. In this case, I first talk a little bit about my value. I think as an athlete, I will give 100% in the competition, which is my job. And if my body is not allowing me to give it out all, I may give up the game. I will find every method to rehab first before giving up, and usually I will avoid medicine. I will always find a natural way. Finding medicine is my last option, because first I was afraid of doping, and secondly I think every medicine actually is doing harm to my body. Also, I think team first. I won't do anything that harm my team, and health is most important. So in this case, is her decision autonomy? I think we can discuss through the following questions. Did she understand that the drug is banned, or did she know that actually she need to apply for the TUE to use this drug in competition? Did her decision informed it or influenced? And can she access to proper guidelines to how to deal with medicine that maybe violate the rules? According to some study, uh, we found that Kenya athletes actually have a low level of anti-doping education. About 42% of them report is they got low level, and yeah, and while actually some Kenya athletes have a high level of knowledge in anti-doping, but usually they are very elite athlete, like the long distance running, but maybe not the trail running. And because of these athletes always going different places to compete, they may not have updated information of anti-doping. So for her case, I think Jolene is actually lack of the knowledge of anti-doping. She fully trusts the doctor, and she's willing to do everything to get back to the game. For me, according to my value, I think it's athlete responsibility to check if the medication is banned or not. Secondly, beneficent, which refers to is this action promote the well-being of others? Is this action promote health or recovery of jawline? Are there any safer alternative? And yeah, who is take care of her well-being? For jawline point of view, I think she needs the prize money to feed her children. And for her coach Lion, I think in his point of view, he needs Jolene to race because she's one of his best athletes, and she may get good results, so the sponsors can continue to support them, and also this may inspire other Kenya trail running athletes to compete in this high level of competition and to win the prize to get out of poverty. But for me, I think there should be other safer alternatives and more natural. If no, I may give up the race this time to let my knee to heal. For non-malfeasance, is this action causing harm to others? I think it's really definitely caused harm to her career, reputation and health. She got 2 years ban, no medal, and actually need to reimburse the prize money and any other costs. And also the sponsors terminate immediately after this case. And also trail running before this case actually is so clean compared with other sports like track and field, cycling and weightlifting. But I think this will actually harm to the sport's integrity, and maybe after athlete too. Could it be prevented? Definitely, trail running community image was being harmed. For me, it is quite harmful to the team because sponsor got terminated, and other Kenya athlete may afraid to compete in this game. For doctors, maybe their responsibility is just to focus making the athletes back to the game. So lastly, justice. Did she being treated fairly? And is anti-doping resources being equally distributed? I think if you want to play the games, you need to know the rules. So, but in her case, I don't think she had the fair and equal opportunity to receive information about anti-doping. So my question is Jolene deserve being punished by her act? Thank you, and this is my presentation.